This WTVO Channel 17 News special report, Living with Breast Cancer, is brought to you by Swedish American Health System. Trust the best. Dr. James McAdoo Cosmetic Surgery. Maximum results with the smallest incisions. Hospice Care of America. It's about living. And by Integrated Home Care Women's Health Center, providing women with mastectomy prosthesis solutions. And High Maintenance Salon, defining relaxation and beauty.
When mastectomy is imminent, it is important to have all your reconstructive options. Dr. James McAdoo, a dual board-certified general and plastic surgeon, will carefully listen to you and achieve your best possible cosmetic result.
Dr. McAdoo and his staff were just so comforting.
He was with me every step of the way, answered all my questions, and I couldn't have gotten through it without him. I am extremely thrilled with the results I achieved.
McAdoo Cosmetic Surgery, discovering the true image of you.
And welcome back to our special report, Living with Breast Cancer. Restoring your body image after surgery is an important part of recovery for many women. Through plastic surgery, it's made a big difference in the treatment and the recovery process.
Because of my age, my doctor thought I should have a mammogram done, and it was scheduled, and I had the very scary call back.
The reason I considered reconstruction was my age, my children, my husband. I just don't think I'd feel comfortable going without having the reconstruction done.
My surgeon recommended that the reconstruction take place immediately with the double mastectomies, and Dr. McAdoo was actually in the operating room beginning the reconstruction the very day that I had my mastectomies done.
I chose Dr. McAdoo because of his reputation throughout the community.
Dr. McAdoo was just wonderful at explaining the process to me of coming in every 2 weeks to get so much filled into the expanders that I had inserted into the breast during the initial surgery.
Helped ease my husband and I's struggle with the original diagnosis, explained my options that I had, went over everything very carefully, and made sure that I was making the right decision.
He told me all along the way just what to expect, pain to expect, what upcoming surgeries, appointments I would need. If I had any questions, I called and had immediate answers.
He went over the process of the reconstruction, the multiple surgeries involved in it. He was very patient with us.
Dr. McAdoo and his staff were just so comforting.
I couldn't have asked for better results with what I had to go through. I am extremely thrilled with the results I achieved.
Over 6 years ago now, my first surgery with Dr. McAdoo was just 2 weeks before the birth of my first grandchild. And she's now 6.5 years old, and I feel normal. I feel like I'm just getting on with things.
My advice that I would give other women that are debating on whether they want reconstructive would be to do what you feel is best in your heart. You'll know when the time comes what you would feel most comfortable about, and go with what your heart tells you.
It's going okay.
And Dr. McAdoo is with us now to talk more about reconstructive surgery. Thanks for being with us tonight. Now, the patients in the story that we just saw were very happy after having these procedures done. When can a woman have reconstructive surgery?
I recommend they talk to their plastic surgeon as soon as they get the diagnosis.
Really, before even having any treatment options or treatment done?
Well, they usually come in to see what possibly can be done, and we give them hope, remind them that their maker still loves them. They're usually in the, oh my God, I have breast cancer phase. We work through that. We work through their feelings of how that devastates their life, and then we give them hope and options for how the reconstruction process can be done.
Now, when a patient has been diagnosed with breast cancer, you said they should consult with a plastic surgeon immediately. Then when can the actual surgery take place?
Well, the sooner that I get involved, the patient can have a better understanding of the whole process, because I'll be present at the time the mastectomy or lumpectomy is performed, and immediately can give them options to have their breast completely filled up as it was before, even filled up more if they desire.
Let's talk a little bit about that. What's involved with the process?
Well, if the patient would like to maintain the size that they are now, we can simply just do an incision with in the inframammary crease area. If you pull up that first diagram, you'll see that the incision can not even be around the breast, it can be far away from it, so there's no actual defect as a result. The recent studies show that you can even leave the nipple and areola intact if the tumor is far enough away and it's a certain size or less.
So with that type of incision, what kind of scarring can the patient expect?
When that area down underneath the breast where there's no tension, you can expect a very small, thin line.
Now, does health insurance usually cover this type of procedure?
Yes, health insurance in 2005 was mandated that they have to cover symmetry procedures and the affected side. So the patient only has the option to reconstruct, but also change the other side to make it match.
Now I see you brought some things with us. What do you have here?
Right, this is a tissue expander that can be placed at the time of surgery. This will go in if the patient wants to have a larger breast or near the same size that they have before the mastectomy. This goes in and it's placed under the muscle, and you can use another piece of tissue called tissue matrix to cover the bottom pole to give you that more curved effect at the bottom. What happens is that this is placed behind the muscle, and then a needle is inserted through the skin into this port where the fluid then fills this bladder and eventually it becomes the size desired. When the patient reaches the cup size that they like on their body and fits inside their bra, then we expand this another couple cup sizes beyond that so the skin is stretched and you can have a more tonic look, a more mature breast that has a curve at the bottom. After that's completed, this would go in, which is a final implant, which is silicone usually mimics the breast fat and the breast gland the best. It's a little lighter than fat and water, so if you have a debate on what's to put in, a saline or a silicone implant, this will actually perform and function like a normal breast tissue when you move around.
Now, for a while there was a debate that silicone was bad. Has that changed?
Well, the reason that was debated is because the viscosity was lower in the past. So it used to be two separate pieces. It used to be an actual saline bladder filled with silicone oil. When the saline bladder would leak because the oil would break it down, it would get into the lymph nodes and plug them up. Now it's a one-piece structure where the viscosity is actually lower, and so the piece is one. And if you were to cut this and hold it up, nothing would come out. It would just hang there.
Oh, is that right?
So it's near a gummy bear consistency.
Now, how long will these last? Will they be able to keep these for the rest of their lives? Or?
Well, the company gives you a 10-year warranty and time of duration to replace it for free and give you some money towards the surgery. And they recommend you get an MRI every few years, but I have not had to remove any of these so far.
That's interesting. Now, what kind of recovery can a patient expect after this?
Well, if you want to be the same size, this would go in at the time of the mastectomy. You'd have your normal breast tissue and nipple over the top and the incision at the bottom edge. You would have a basically an underwire bra with some gauze over the incision, and you'd wear basically a normal bra within a week.
And what's the process as far as pain goes?
The pain can be aided by the insertion of a pain pump. This particular brand is called OnQ, but there's many available. And this little catheter will be placed around the implant area at the time of insertion so that there's a constant drip of numbing medicine in the implant pocket and the area where the mastectomy is performed. And patients usually experience that this pump will last for 4 days. You can refill it and get about 2 weeks worth of pain relief without taking any pills, which removes the whole cloud of mentation and all the side effects of medication.
That's amazing. All right, Dr. McAdoo, thanks so much for being with us tonight.